Everyone, welcome to my YouTube channel Nursing Education. Today I'll be discussing about the minor disorder in pregnancy. So let's start with this topic. Minor disorder are the disorder which is associated with the pregnancy, such as nausea, vomiting, back pain, heartburn, constipation, etc. Most of them are not dangerous as it is just a normal part of pregnancy, but it is good to be able to spot a symptom and treat them. The lots of them can be alleviated using some simple remedies and proper explanation to the woman. Fortunately, most of this discomfort will go away as a pregnancy progress, and some women might not feel any discomfort at all if the woman had been pregnant before. First minor disorder is nausea and vomiting. So it is also known as a morning sickness, as it is especially occur in the morning soon after getting out of the bed, and so hence its name is a morning sickness. But it can be occur at any point during a day or night, and it's common in the primigravida woman and the multigravida woman, and 50% of the women have both the nausea and vomiting, 25% have nausea only, and 25% are unaffected with this nausea and vomiting. They usually appear following the first or the second missed period and subside by the end of first trimester. So to reduce them, there are the certain measures that can be taken. So first one is the dietary changes. As a nurse, you have to advise the woman to take a dry toast, biscuit, and protein-rich meal. And also you have to tell the woman to have a frequent small food and avoid a fatty food. Second one is a behavior modification. So in the behavior modification, you have to tell the woman to identify a personal triggering factor, so which increases the nausea and vomiting, and to avoid that triggering factor. And last one is initially supplement with the vitamin B1 and the B6 should be started. Okay, so next one is a backache, and backache is also the common in the pregnancy, and 50% of the women during a pregnancy get a backache. And there are the physiological changes that contribute to the backache are hormonal changes that during the pregnancy hormone like estrogen, progesterone, relaxin is increases, and we make the joint ligament to loose or relax, and that is one of the reason of getting a backache. And another causes is a weight gain. If the woman is getting more weight, gaining more weight than the normal in the average BMI woman is 12 kg, and if the woman is getting more than that, so that may be one of the reason of a backache. And another is the anterior tilt of the pelvic. As during the pregnancy, different changes occur in the pelvic organ as your baby grow in the uterus, and uterus is size is increasing. So, and in that case, the pelvis will be tilted on the anterior side, and that may be one of the reason of getting backache. And other factors may be a faulty posture. So faulty posture are natural during the pregnancy due to the hormone changes and the due to the increasing size of the uterus. And also if the woman is wearing high heel shoes, so that also causes the backache. And there are certain conditions like muscle spasm, urinary infection, or constipation. So constipation and urinary infection is a common during the pregnancy, so this can be the cause of the backache, and you have to identify all these factors if the woman is having a backache. So there are the management to reduce the backache, and these are you have to advise the woman to avoid excessive weight gain by advising regarding a dietary pattern, and to advising regarding a balanced diet. And also rest is one of the measures that can be taken to reduce the backache. And whenever a woman is resting, you have to advise the woman to rest on the hard bed, so it's often relieve the symptom. And also improvement of the posture can be one of the management, and well-fitted pelvic girdle belt you have to advise the woman to wear, and which correct the lumbar lordosis during a walking. And also massaging of the back muscle is one of the management. And also if the woman is having a severe back pain and it is not reducing with the management that I have told about, then you have to give the analgesic to the woman with the prescription of a doctor. Another minor disorder in the pregnancy is the constipation, and constipation is a quite common element during a pregnancy. And causes of the constipation are atonicity of the gut due to the effect of progesterone, and the progesterone relax the gut during a pregnancy. And another causes is a diminished physical activities, and if the woman is not performing any physical activities, that might be one of the causes of getting a constipation. And next one is the pressure of gravid uterus on the pelvic column. To manage this, you have to advise the woman to drink plenty of water and include the physical activities in daily routine, as being active can help to prevent the pregnancy constipation. And also you have to advise the woman to take a high fiber food such as fruit, vegetable, bean and whole grains. So these are the management which help the reduce the constipation. Fourth minor disorder during a pregnancy is leg cramp, and leg cramp are a painful spasm. They usually occur in a calf or the foot muscle, and in the leg cramp muscle involuntary contact, and it maybe last up to 10 minutes. Leg cramp are common during a pregnancy, particularly in the second trimester and third trimester. And it might be caused by the fatigue and the uterus pressing on the certain nerve, or decrease the circulation in the leg from the pressure of the baby on the blood vessel. And it also might be due to a deficiency of a diffusible serum calcium, or elevation of the serum phosphorus and dehydration. And leg cramp management include the supplementary calcium therapy in a tablet or syrup after the principal meal may be effective. And in all of the women during a pregnancy, calcium tablet 500 mg is given after a 12 week of a pregnancy till the 3 months of after a delivery. And another management is massaging the leg, and also the application of local heat and intake of vitamin B1 daily may be effective. Fifth minor disorder during a pregnancy is acidity and heartburn. And acidity and heartburn is a common in the pregnancy due to the relaxation of the esophageal sphincter, and this relaxation is due to the progesterone hormone. So what happened exactly in the pregnancy? During the first trimester, muscle in the woman esophagus pushes food more slowly into the stomach, and the stomach takes longer to empty. This gives a woman body more time to absorb the nutrient for the fetus, but it can also result in the heartburn. And during the third trimester, the growth of the baby can push the stomach out of its normal position, which can lead to the heartburn. So it's depend upon the many factors, including the woman's physiological changes and diet and the daily habit, what she is doing after having a food. So these are the factors that contribute to the acidity and heartburn during a pregnancy. And another common condition is hiatus hernia, if the woman is having hiatus hernia during a pregnancy. So it is one of the common during a pregnancy, and it can also produce the heartburn, especially when the woman is lying down. Woman is in the lying down position, and if the woman is sleeping in semi-recycling position with high pillows, it's relieve the symptom if it is due to the hiatus hernia. And for the management of the acidity and heartburn is you have to advise the woman to avoid overeating, and not to go to bed immediately after having a food, and eat a small meals more frequently. Avoid drinking while eating. Eat slowly and chew every bite thoroughly. Avoid a food and beverage that trigger the heartburn, such as chocolate, fatty food, spicy food, acidic food like citrus fruit, tomato-based items, and caffeine. And also you have to advise the woman to stay upright position for at least 1 hour after having a meal, and wear a comfortable cloth rather than the tight fitting clothing. Another minor disorder in the pregnancy is a varicose vein, and varicose vein are a twisted enlarged vein. Any superficial vein may become varicosity, like vulva, rectum, legs, but the most commonly affected are those in the legs, and it may be appear for the first time during a pregnancy, or it may be aggravated during a pregnancy, usually in the later month. And for the it is due to the obstruction in the venous return by the pregnant uterus. And for management of varicose vein, you have to advise the woman to avoid sitting or the standing in the same position for the long period of time, and avoid wearing high heels, perform regular exercises, and avoid crossing leg while sitting. And if the woman is having varicosity in the leg, then you have You can advise the woman to wear elastic bandage during the movement, and elevation of the limb during the rest can give a symptomatical relief. During the pregnancy, it's better to avoid a specific therapy, and varicosities usually disappear following the delivery. Another one is hemorrhoid, and hemorrhoid are the swollen vein in the rectum, and it is one of the common to get them during a pregnancy, especially in the third trimester, and it may be causing annoying complication like bleeding, or it may get prolapse, and it may also cause itching and burning pain if the woman is having hemorrhoids. And for the management of hemorrhoid, usually the hemorrhoid may disappear completely after pregnancy and delivery without any treatment, as the woman hormone level, blood volume, and intra-abdominal pressure decreases after the delivery. And but also there are the certain things that can be done during a pregnancy is a regular use of a laxative to keep the bowel soft, and local application of hydrocortisone ointment, and if the hemorrhoid is prolapse, it can replace, but it is better to withhold surgical treatments as the condition sharply improve following the delivery. Another minor disorder in the pregnancy is a carpal tunnel syndrome, and it is one of the condition where the woman present with a pain and numbness in the thumb, index, and middle finger, and it is due to the compression effect on the medial nerve. What happened in the pregnancy? During the pregnancy, hormone level trigger the fluid retention, which can cause the swelling, and the swelling can in turn push against the medial nerve in the carpal tunnel, which increases the pressure in the carpal tunnel, and this causes the symptom like pain and numbness. And regarding the management of the carpal tunnel syndrome, treatment is mostly symptomatic, and the splint is applied during the sleep time to the slightly flexed wrist to give a relief. Corticosteroid injection or surgical decompression is rarely needed during a pregnancy because it resolves spontaneously following the delivery. Another condition is a tylism. Tylism is a condition that causes the overproduction of the saliva, and the increased secretion of the saliva is observed during the pregnancy. And tylism is associated with the increased intake of starch, and though the actual causes are not known. Tylism is common during the first trimester of pregnancy. Bitter taste of the saliva can cause nausea and vomiting. The good news for the most women is that it decreases after the first trimester, and this problem is usually self-limiting and may be overcome by decreasing intake of carbohydrate, and it is not associated with any adverse pregnancy outcome. Another disorder is a syncope, and it is the most common during the first trimester, but it can happen at any time during the pregnancy. And syncope is often seen in the woman who is standing for the prolonged period of time, or if the woman is standing suddenly. And this is occurred due to the pooling of the blood in the vein of the lower extremities, and it may be causes due to the effect of a compression of the pelvic vein by the gravid uterus. And syncope is usually resolved rapidly on the lying the woman in the left lateral position, and if the woman is getting a syncope in the supine position, it can also be managed by resting the woman in the lateral recumbent position. Okay, so next one is the ankle edema, and ankle edema is common during the pregnancy, and it's occurred due to the excessive fluid retention in the ankle area. And whenever we are identifying the physiological edema, we need to see whether the woman is having a preeclampsia or the edema is look like edema due to the weight gain. So these things need to be excluded, and then we have to identify the physiological edema. So if the woman is having a physiological edema, no treatment is required, and edema subside on the wrist with the slight elevation of the limb. So we need to advise the woman to elevate the leg while she's resting on a bed. And diuretic should not be prescribed in the physiological edema. Last one is a vaginal discharge. It is a common during the pregnancy, and almost all of the women get a vaginal discharge during the pregnancy. And it is also normal to have more vaginal discharge in the pregnancy because it helps to prevent an infection traveling off from the vagina to the womb. And its amount of the discharge increases further toward the end of the pregnancy. And in the last week of the pregnancy, it may contain streaks of sticky jelly-like, jelly pink-like mucus. And For the vaginal discharge, we just have to assure the woman and advise for the local cleanness and all that required, and you have to tell the woman that to change the panty daily and also to keep the penile area clean. And if the woman is having a discharge like a cody-white discharge or any greenish discharge, we have to send the woman for the further investigation, because it may be sign of infection like a trichomonas or candida or bacterial vaginosis, and it's required treatment. So we have to send the woman for the further investigation. And please like the video, subscribe and press the bell icon to get a more video. Thank you.